All right, so when you come into your Evolve, you're going to have a bunch of different courses. You're going to have BEEPS 106, you're going to have BEEPS 206, 105, and 205, which is up here on mine. For the purpose of these, I'll see if I can figure out how to rename them. But for now, it'll say BEEPS 106. Eventually, I'll get it switched over to Nursing 2 and BEEPS 106. Everything's housed in this one area for both Nursing 2 labs and for BEEPS 106. So this is where we're going to go to do our SimChart setup. So you click on SimChart setup, and it's going to bring you into this area here where it's my cases. For the SPEs, you're going to have to set it up as a simulation, and you'll see these are all the ones that we have right now. This is the practice one that we used for Nursing 3. What I'd like everybody to do when you do this is set it up as SPE, and then the, whatever it is, ours is, ulcerative colitis. So if you could just set it up the way that it is that way, so it kind of makes more sense. All right, so I'm going to go in here and I'm going to create new, and you'll see it says that it's incomplete. So you're going to do setup, and in here you are going to do the patient. So it would be SPE. Okay, so I started to fill in the top here, and then the other thing that you're going to want to do is pull in your simulation learning objectives to put them into here. Your just short description really is all you need there, and then the rest of the description, in this area, you'll just put your objectives. So they'll see this when they log in to look at this. So it's a medical surgical floor. Your room for these is going to be room 3A. You can put a picture in if you want. The thing that's important is your medical record number. When they do this, you also want to make sure that you put that in here. So we can put it in here, MR number, and I'm pasting that in. And the reason that we want to make sure that we're putting that in here is so that when David loads the patient into the Pyxis, we have a consistent name there. So Cindy and her last name, so we're going to put that in. We're going to put this. You're going to get her age in here. Her primary diagnosis is, see what that was there. So you're going to click there. We'll just put that in here. It looks like I wasn't sure if it'd give you a post-operative, so it doesn't have it in there. We could put abdominal pain, just so think of other stuff that you would have. I don't really want to put acute because it's not acute. She's had it, so we'll just leave that. So your admission day that you want to really put in here, I always do Sunday, I don't know, it gives me more, but actually wouldn't do that on Sunday, so we'll probably do a Monday. Your admission time has to coincide with your scenario. So basically this patient had surgery at 7 o'clock in our case, and she's going to be coming back up to the floor. So you're taking over, and it's now noon. So we'll say that her admission was at 6 a.m. Your provider information, which you need to make sure you have in here too. MD. So all of that stuff has to be filled out in here, and then you're going to go ahead and save it. When you want to go back to do more information, you're going to go return to simulation. So now your simulation and patient profile is set up. Now you need to set up your quiz timeline. So you're going to go into your quiz timeline, and you'll see for now these are the only things that are in here. In order to add more into this, you need to go into this area. Sorry, I'm not sure why it's not letting me edit it. Oh, that's why. I have to do phase 1. So set the start time, the amount of time the student has to complete the activity. So the patient comes in on at 6 o'clock, and we want the student to be starting this on Monday at 12 noon is when they're taking over the care. And then the allotted minutes, we can set it at 60 minutes, just so they have the full 60 minutes to get in and document here. So our learning objectives are on the other area. We really don't need to put any information in here for them. We're going to be reading them the information that we need them to have, so we don't have to do anything with that. So I'll just say save. When you get in here, then once you set your phase, you're going to do your edit for your signatures, and you're going to put any name, the name of anyone who could potentially be on the chart. I would say have the nurses be whoever created the scenario, and that way we can track it. So I'm going to put I'm going to pause this and I'll put these in and I'll come back to you just so you're not sitting here watching me type. Okay, so now I have Nicole and I and Bill in here. He's going to be the doctor taking care of our ulcerative colitis patient. So I'm going to go back to my timeline, and you'll see here that this doesn't have the not configured yet or anymore because it's completed. The authority for admission, this is just kind of a little strange, but we're going to say it's a routine, what the diagnosis is. This kind of pulls all that in. If we ever wanted them to look up the ICDs, we could have them do that. So it's pretty neat that you can do quite a bit. So our unit's going to be HVCC hospital, or say hospital floor. Admitting service would be Dr. Robinson. We'll put a W. So I'm just going to pause this again. I'm going to fill all this out and give you some of the information. I'll bring you back in just a second again once I type it all in. Okay, so up here, I just basically went in and made all this stuff up. So you're going to put what their procedure is if they're having a procedure done, put in like a address. On your case, you should have on that first page what the religion is, their support system. So this is where they're going to get some of their social information right here on this sheet. You just put their address, who their, spouse or significant other is. I also usually will put that on here. So where it says living married with an 11-year-old son, so that faculty know that that's what's in the chart. What did I say? David, I think Smith. Yep, David Smith. So I just usually will put that on here just so that they know. Whoever's running the scenario, and then it's not something you have to look up. It'll be right on there as you familiarize yourself. The other thing, too, is we want to just put on here if they have any advanced directives. Basically, I'm just going to say here that we're going to provide a copy of the advanced directives so that they know that the patient has it. And then I'm going to save that. So now I'm going back. Saying I didn't save. Sorry, I'm just looking at this. Is one of the things it does do. It'll give you like a little red flag if you forget something. Please provide a nurse. Oh, right here. Sorry. So this is whoever actually did the intake. That's the one thing I missed. So as you see, this is brand new. So I'm kind of learning it as I'm going along here too. And you're going to find sometimes it's going to say that you missed something. Just kind of go through and do it. Go back and look at it. If you need help, reach out. So this stuff here, this is your summary. So this stuff is what you need to make sure that you're putting in here. So on here, you can go to provider charts. You want to do a history and physical. So you want to add this in there. So you're going to fill this out with a physical exam and the impressions. Provider orders is the other thing that you're going to want to make sure that you're doing. So you're going to type out any of your orders that you have in here, which again, if you remember, it is going to be right on your scenario sheet, you have your admit to surgical floor with the diagnosis, your code status, your diet, your activity, all of that stuff should go right in here, and you should be able to. So if I go into here, excuse me, we can go to right here. It saves you time if you just copy and paste it right in. So this is all right here. You're again going to have to make sure that you fill this out. The other thing is you can't tab. You have to move this over. It's a little annoying, but. And then you're going to save that. So there's your orders. The other thing that you do need to make sure, so you might want to put in like a progress note somewhere in there, maybe something from your, post-op, uneventful surgery, whatever. Patient charting, you want to make sure that you go into here and so you're going to need to put in a few sets of vital signs, the intake and output. Your height and weight you want to put in here for the patient. I'm going to go in and do all of this stuff, but just so that you can see it, how I'm doing it, and what you want to make sure. Yeah, she's not 96. She's 96 pounds. She is 62 inches. So she's 5'2". Scale, save, and you'll see when you do this, it actually will put it up here. Like the code status and everything is right up here. So you kind of want to just get in here and play around with this and put it in. When you go into here and you do your order entry, so you'll do your pharmacy, your laboratory, your diagnostic tests, therapies, general orders, nutrition. So I can put her nutrition in here and just say diet. I'm going to make her NPO right now. So I'm going to add that order so that we have her NPO. I'm going to submit that. And then what you should see up here is now that diet is up here. So that kind of fills in this top as you're doing it. It shows she's on a medical surgical floor. So now you got her female, her age, that she's female. She's 33. She weighs 96 pounds and she's 5'2". When you go in and do your pharmacy orders, so as you go in and do these, you want to make sure, again, you have the nurse, your time. You're going to select your order. So for us, we have the orders for the patient. So we've made her NPO, our IV fluid. So we're going to do so sodium chloride with 20 MEQs, so it's down here. We're going to do administration, IV infusion. We're going to do that at 100 mLs an hour, continuous. So we're going to say we're going to start this on Monday at 6 o'clock, and we are going to continue it through, we'll say Wednesday at 6 a.m. So then I'm going to add my order. My next one is going to be my hydrocodone. I did the 325 5 milligram. So that's my PRN. I'm going to do that again, started on Monday at 6. In my orders here, I can go right into my orders here and put it right there. So I'm going to copy it. And I'm going to put it in here. So oral, special dose, 1 to 2 tabs. One to 2 tabs I'm going to say every 6 hours, and I'm actually going to change that on here. So you'll see as you're doing this that you're probably going to be changing some of your, some of your chart based on SimChart too. So you kind of want to do this simultaneously. And I'm going to add that order. Special dose should be a positive number. So I'm going to have to put it in as 2 orders. So I'm kind of learning as I'm going too. Sorry, guys. So I'm not going to do a special dose. I'm going to do 1 tab every 6 hours for moderate pain. I'm also going to then have to go back in and do it PRN. I just pulled that in here. Oral. 2 tabs every 6 hours. So you just kind of have to go through. I know this is like a little bit tedious and it does take a little while. It's a lot better than it used to be. We're going to do this one for Wednesday until later. So those are in here. I'm going to finish putting these in and then I'll come back to you for the next section. I actually just realized this and I want to make sure I point this out. I had to go through and delete them all and I'm re-putting them in because up here you need to actually put in the time that you want that to be listed for them to chart. So I'm doing that right now and I will be back. Okay, so another area that has a lot of information is this patient charting admission history. I'm going to go through and start filling this out, but you want to make sure you do almost all of this here. It gives you admission forms. It gives you information on their family, their home medication information, which you should have in the chart, immunizations. It gives you quite a bit of information in here. And all of this also translates up into this area as well. So I'm going to fill all of this in. I'm going to stop this. I'll come back and show you after I filled it all in what it looks like. You also want to make sure you're doing a systems assessment. You can maybe do it just before they come in so that you have it, when they want to go back and look at it. Basic nursing care, there's stuff in here that you can put in, so safety, skincare, anything. Their IVs, you want to make sure that you're putting in all IVs for these patients. I know it's a little weird. It's always going to be the right AC, so it's always going to be, if it's a regular IV there. For our patient, we actually have the patient with a TLC. Let's see, right subclavian. So we're going to do, here, and it's making me do it again. So, and it automatically shows you what the patient, what it is. We're going to do triple. So we're going to say, let's put in the OR, and then just, clean and dry, dressing, clean and dry. One of the things they may have to, do is change this. No complaints at this time. So we might even just say that the patient, the TLC got soiled in our report if they do get that and that they have to change it. An infusion pump in use. So you save that there. So now that'll also pull up to, the patient information. So again, you just want to make sure that you're doing that. Any drains or tubes. In our case, our ostomy. So we're going to make sure we mark on here. I would also, when you go ahead and mark this, let's see. Ileostomy, stoma condition. So you're going to want to fill this out. So you know, just kind of go through and see, you know, what you need to fill out. But if you do put something in here, you know, just make sure that we're sharing that with David. Pink. Really haven't done anything with it yet. So we're going to save that. For this, I probably would, for the ostomy, so that David knows where it is, take a screenshot. Those are like pretty interesting boobs here. It's like, wow. Hopefully, we'll have to make sure we tell him not to open this at home. It's not doing it, actually. I got to go in. Insert picture. So I have that in there. Just so it's consistent with where it is. I'm just trying to think of stuff as I'm going to. And if you guys think of stuff that you think is important, let me know. So I'm going to kind of keep going along here, filling this stuff in. The other thing when you do order entry, this is one of the important things, is if you do like your laboratory orders, you're going to actually have to go and put the lab orders in here. So if I'm going to put in my panels, because obviously you're going to probably do like a complete blood count. You might want to do like a time, you know, routine, order it daily for 3, well, it won't do that. So, maybe start that Monday, and that would probably be at 6 o'clock. Venous blood, add the order. We'll do another panel. So I'm going to do the metabolic. Basic, I think comes in as basic metabolic panel. They don't have complete in here for whatever reason. I'm not really sure why. So you're going to do your routine. We'll do daily. We'll start it Monday at 6 o'clock. So hopefully they'll have drawn that before surgery. Venous blood. So we'll probably have done a urine test too. Just gives them more to look at. It's not letting me just do that. I'm just going to leave that one out anyway. I'll play around with it, but you can kind of play around with these. And when you submit these orders, just to give you an idea, you're going to go in after you submit the orders into your order results, and you actually have to go in and put them in here to configure them. So this is giving them to me Monday, Tuesday, and Wednesday. So you know, they're obviously not going to see Tuesday and Wednesday, but it's making you configure it. If you want to just do one day, you can just do one day. However you want to do it, that'll work. And then when you go into your MAR, you'll see that pulled these in so that they'll see these. If I want to, I'm going to have to play around with this too, because this is actually scheduling it at 1 o'clock. That one doesn't give a time. I'm not sure why it's automatically scheduling at that time, but I'll look into that and get back to you guys too. Okay, I wanted to actually show everybody this too, just as we, you know, move forward and start thinking about stuff. You can actually select a medical diagnosis and they can pick a nursing diagnosis. makes them say whether it's actual or potential, and then they actually have to free text in here the related to, the evidence, and the expected outcome. So we could potentially use this, and then their interventions, we could potentially use this um, as a way of having them document. So just a thought, it actually fits pretty well with our with what we are doing right now. So that's under care plan. If anybody wants to take a look at it, it may save us paperwork, and they can actually save it, upload it, and we can go in and review it. So just a side note here. For the purpose of these simulations, when you go into vital signs and you put the vital signs in, we really don't want to make it too confusing for them. In nursing 1, nursing 2, we might want to kind of play around with things a little bit so they recognize that vitals may be abnormal. But again, for the purpose of this sim, we really don't want to do that. So please try to, for the nursing 2 SPEs, put in normal findings for your vital signs, and especially for ours being post-op, at least put in a few sets of vitals so they can see a trend. Okay, so you're going to see here, I just did a whole bunch of vital signs for us since our patient was an operative patient. In some of them I put notes, like I just put when the procedure started, whatever, so they can see like a trend and they'll see all the vitals there. And here for intake and output, I'm just going to put in here the fluid. I'm going to put in LR for during surgery. I'm going to put in 1,000. And I'm going to save that. And then I'm going to put in our sodium. So we'll say they've gotten 200. I also put the note in there so that it's in there. So if they ask and say, oh, it's not in there, it's right there in the note. One of the areas I just want to show you guys in admissions history under health history, even for ulcerative colitis, it's actually not showing up in here. So when you get to the bottom of here, you can actually, in other health history, put that in here just so that you have that to put extra stuff into. This is the area that you're going to add your allergy information. So you're going to go to add allergy. I'm going to do medication. Add an allergy. So our patient's allergic to aspirin. You can pick any of them. We'll say itching, hives, self, moderate. I'm going to add another allergy because they're also allergic to let's see. That's interesting that there it is. I was going to say, I didn't think it was going to come up. So you can see, you can just kind of fill all of these in here. For ours, we don't want to do penicillin V because then it's going to give us it would contradict the other. So we'll save that, and now you'll see up here it should. It's interesting that it's not coming up here. It should be, and I'm not sure why, but I think there's gonna be another area it's gonna flag us to. It should pull from there into here. Let's see. If it's in here. Code status, we're going to do full code. Oh, allergies popped up. That's weird. Wasn't there a minute ago, but it's there now. I'm adding our consents. I'm just trying to think of anything that you could potentially want on here. Most of that is actually in here now, but I'm just going to go through. So you're going to want to do that. Just go through. The most important thing that you guys can do is make sure that you have a systems assessment, your admission stuff in here, your labs, your pharmacy. Make sure everything's pulled into the MAR, your nutrition. So everything we've kind of talked about is the most important stuff that you'll pull in here. And I apologize, this is probably super boring, but as you go through, that's really the big thing. The times I find that I have issues are if the provider name isn't in here. So just make sure provider name, and then make sure that your charting day or time is after the phase starts. So if your phase starts at noon, make sure that your first time you're giving a med is after that. Usually put it at like 12:30 so that we have time. And just pay attention to kind of the times, the information, and if you have any questions, again, please reach out.